Welcome to Compass Points, the weekly podcast for CompassKnox.com. CompassKnox.com is your best source for news and politics in Knoxville and Knox County. Your hosts today are Scott Barker and Jesse Mayshark, the founders of CompassKnox.com. You can find their daily in-depth coverage and subscribe at CompassKnox.com. The Compass Point podcast is brought to you in conjunction with Almost an Agreement. Almost an Agreement is a layman's attempt to get a handle on the workings in government and politics that we deal with every day. Check them out at almostanagreement.com or subscribe for free on your favorite podcast provider. If you'd like to learn more about the topics discussed on today's podcast, go to CompassKnox.com and subscribe for in-depth coverage and much more. And now, here are your hosts, Scott and Jesse from CompassKnox.com.
It's beginning to look a lot like Compass Points. That's right. It's the weekly podcast where we don't sing Christmas carols. We talk about Knoxville government, politics, news, education, business, really whatever gets our attention. I am Jesse Mayshark, co-founder and co-publisher of Compass, which you can find at CompassKnox.com. And I am here in the luxurious Barbarian Productions studios in Rocky Hill alongside Scott Barker, also co-publisher and co-founder of Compass. And we are sipping some delicious Pennsylvania Dutch eggnog. How are you doing, Scott?
Better now that the eggnog is here.
It's pretty good eggnog.
Folks who are listening should, just want to reassure you that I will not be singing at all. Not even as a joke. So.
Sorry, I've already broken that.
Well, you can do that. I mean, yours was fine. Mine would scare people.
I mean, I'm a big Leonard Cohen fan. I love a good gravelly singer. What's wrong with that?
I'm dreaming of a rezoning. All right, we do have a couple of things to talk about this week, but just a couple because it is the week before Christmas and civic affairs kind of, I don't know, not grind to a halt exactly, but peter out, let's say, toward the end of the year. So this is the week of the petering. We're going to talk a little bit about the legacy of Lillian Bean and the Bean Machine, for those who remember those days of Knox County politics. Couple of interesting land use decisions, an affordable housing complex way out in West Knox County, and also a controversial large development in South Knox County took another step forward. But Scott, to start off, you wrote this week about the Office of Housing Stability's approach to both immediate needs of our local homeless population during the winter and the efforts that are being made there to try to keep people warm on the coldest days that will be coming, as well as their longer-term efforts to really bring together all of our local resources into a master plan. And, we've certainly talked about homeless issues here before. I think it's something that kind of always bears talking about and bears getting into the details a bit, because it's one of these issues that lots of people have concerns about, lots of people have opinions about, and what is often lacking, I find, in local discussion, for example, when I see it break out on Facebook or somewhere, is really a lack of awareness and understanding of what is being done, what resources are there, and how they are being put to use. So what do you have to tell us?
Yeah, it's especially good this weekend is I've got a couple of days that are supposed to be really, really cold. So people who are unhoused have, greater challenges facing them. The Office of Housing Stability for the second year is coordinating privately done managed warming centers, and these are not homeless shelters like CARM and Salvation Army. These are temporary places. They're only open at night. They're only open on nights that it's forecast to the temperature's forecast to be at or below 25 degrees. And it's really to give some relief on the very coldest nights of the year for people who don't normally take advantage of shelters. And last winter, of course, we had the big freeze in January that kind of threw off how they do things because they had to be open 24/7 for essentially a week while that went on. This year so far, it's been kind of the way that they envisioned doing this. I went to a board meeting of the Office of Housing Stability, and also then later had an interview with Aaron Reed, who's the executive director. And this year is running more what they anticipated. A few days or a few nights they would be open, and people would go there at night and spend the night, and then leave during the day and come back and do that. And they have volunteers. They can always use more volunteers. They can always use more things. You can contact the Office of Housing Stability if you want to donate anything, because they can help coordinate that. But the warming centers up until this past weekend had been open 6 nights in December. December's a little bit chillier than normal, just a little bit. Been open 6 nights, and so far over those 6 nights, 766 people nights had been accommodated in these warming centers. And this year, last year there were 3 churches who gave space. This year it's 4 churches, plus they have an overflow space. The churches are Cokesbury Church in West Knoxville, Fountain City United Methodist Church in Fountain City, Magnolia Avenue United Methodist Church in East Knoxville, and Vestal United Methodist Church in South Knoxville. The overflow center is the former Salvation Army thrift store, which its most recent use was as the foyer, which was a low barrier shelter that closed because nobody basically they haven't been able to find anybody who wants to run it and
nobody wants to
follow
run
HUD.
a low barrier shelter.
Nobody wants to run a low barrier shelter, and they especially don't want to do it under HUD guidelines, which you know are truly low barrier. If you have a low barrier shelter, you can have no barriers to people other than being an imminent threat to people's lives. Other than that, you got to let them in, and you can't make any requirements beyond that, and nobody's willing to do that. Anyway, the overflow center is actually, primarily because of its location. It is right by the other, the full-time homeless shelters. The population of unhoused individuals is largest downtown, so stands to reason that's the busiest one. In fact, it's so busy that Reed told me they are looking for an additional space in the downtown area for yet another overflow center if they can get that open before January. January is typically our coldest month. It usually isn't as bad as last January, but it is usually the coldest month of winter, and things then taper off in February. So they believe they have enough volunteers to be open 21 days or 21 nights over the course of the winter. Last year, I mean, even with the granted those 6 or 7 nights where we endure the freeze, while those were horrible and unanticipated, the actual number of nights that it got to the point where they would have been open was only 13. So they kind of built in. They think they have built in enough capacity to be open for up to 21 days. So so that's where that goes. one thing is, they are, as they did last year, doing outreach, letting people know who are, because they know where a lot of the people who are living, outside of, that are just living outside, and they don't know where a lot of them are, and they go to them. And, there is street outreach being conducted to let people know that those centers are available if they so choose to use them. There is always, there's always some resistance to that. But the warming centers appear to be fairly effective. Last winter, even during that deep freeze, only one person who was considered, they know of, who was unhoused, died of exposure during that time period. And we had, multiple nights in a row where, we had single digit temperatures, and also it was a really dangerous time. And just about, almost certainly there were some lives were probably saved by those warming centers being open. And so anyway, that's the as you mentioned, that's the short term thing. It's one of the things that people need to realize. This is not a long term solution. These are not shelters in the sense of people going there and staying there and multiple nights in a row and having daytime activities and things like that. That's not what these are.
Right. These aren't like approved in terms of codes and so forth as residential facilities, which is why with a couple of them, coming out of the warming center experience last year, a few of those churches said they were going to go ahead and open their own like actual shelter facilities. And then we talked about this a few weeks ago, but those have actually been shut down by the Knoxville Fire Department precisely because there's a difference legally between something that's like a short-term temporary emergency shelter where a lot of requirements and regulations get waived and a facility where people are just going to be living for an indeterminate amount of time.
Right. I mean, essentially these the churches were running boarding houses, essentially, and that is you've got all kinds of fire codes to meet when you do that. Sprinkler systems, all kinds of things. They didn't have them, so but like I said, those are waived for emergency warming centers like this. As long as they still have things they have to do. One of the things that they have to do, instead of having a sprinkler system and an alarm system as being requirements, they may have them, but it is a requirement, is that they have to have people who are who stay up all night and watch for fires and anything like that, so that they can evacuate the building if necessary, that sort of thing. So it's but yeah, these are, it's an important distinction that I think a lot of people lose, but these are just places to sleep overnight. And there aren't, they're not designed for people to stay there for any amount of time beyond going in, maybe getting a bite to eat, going to sleep, waking up, maybe getting another bite to eat, then going back out on the streets. So, it's, in Knoxville, there are about 406, beds in shelters,
mostly at Carm. Carm is by far the largest.
But the warming centers have 147 beds, so that on these cold nights there are 553 beds that are available either through shelters or the warming centers for people who are unhoused. Obviously, there are more than that. Obviously, in the area, but that's where we stand now. Looking at the long term, which you also mentioned earlier, is yes, the Office of Housing and Stability basically they're undergoing their master plan strategic planning process. The housing Department of Housing and Urban Development requires that every community that gets federal funds for housing assistance have a lead agency to basically coordinate things. That's always been the city of Knoxville, and now this joint city-county Office of Housing Stability is kind of taking over that role. They're putting together this new strategic plan, and it is looking at everything. It's a comprehensive thing from the prevention of homelessness to rehousing people who have been homeless, and everything in between, the services, the shelters, things like that. What is called the continuum of care in the industry. So they're in charge with coming up with a plan for that, and they are the ones who are coordinating all of the or most of the homeless community services. There are a few, small organizations who kind of go out on their own and do what they want, but the vast majority of the community's response is coordinated through this office. The plan is like I said, it's currently under development. They've had these listening sessions that they've had with the public. They've had over 100 people who've shown up to these listening sessions so far. This year, they're having a couple more. In the early part of next year, they'll be meeting with more providers, with law enforcement, first responders, everybody to try to put this together. They're kind of making it, taking several things into account. It's going to be data-based, and they're going to be talking with, people who serve the homeless population. There will be talking to people who are undergoing homelessness. So it's going to be kind of bringing all these things together as they develop the plan, which should be ready in late spring.
And they already know some things that they've identified, right? Like, for example, the need for broader healthcare options, particularly down there in the area around what people call the Mission District.
Yeah, people call it that, but nobody really wants to call it that. Yeah. But healthcare is a big issue. There is a Cherokee Health Systems runs a clinic on Fifth Avenue down there. They do need more providers. They also go out. They need help in going out to people who don't hang out in the Mission District, quote unquote. To go out to where they are living and providing care. They've done interviews with people who are experiencing homelessness. There are a lot of people who have chronic diseases that are basically untreated. They have wound care is a big issue because cuts and things like that are common when you're living out in the streets, and there are no few treatment options. Infections, things like that can occur. Wound care is a big deal. Is a big need, and also medication management's a big need. A lot of the as we all know, a lot of people who are homeless also have been diagnosed with mental illnesses. Some of them are medication or should be under medication, and getting on medication and staying on medication when you don't have a permanent address is very, very difficult. And so that's a concern. And, and there was one other health-related healthcare-related aspect that I hadn't thought of, that Reed brought up in both at the meeting and in our subsequent interview, was hospice care. Mm-hmm. Because like people in the population at large, there are homeless people who are homeless, will sometimes have fatal diseases, and their last days can be lonely and terrifying, agonizing, a lot of pain. There's really not a place for hospice care for the homeless population, although Carm has an area of their shelter that where they do have that option for people, but in fact, there were just a couple of people who had died recently at Carm who had chronic illnesses, fatal illnesses, and passed there. But there is no facility where people who are homeless can go and get some kind of dignified hospice care, and that's a need that they've already identified. And so all of this again will be synthesized into this report that will be, it is going to be a big deal when it comes out, because it is going to be okay. This is our community's blueprint for how we address homelessness, and the things that are in it are the things they're going to do, and the things that aren't in it are the things that they're not going to do. So that will be coming up then. And then I think we'd be remiss if we didn't mention also this last week there was a memorial service for people who are unhoused and who have passed away in the past year. There were about Reed told me about 140. It's hard to get the number exact, and the number's not exact. They rely on hospital data, and not all hospitals report, and the addresses and things like that to them. The medical examiner reports, other service providers. I mean, they kind of put this all together. About 140 they estimate died.
And 140 is probably like the low number.
Oh, I'm sure it is. Yeah, I'm sure it's the low number. It's the ones they know, people they know who were unhoused at the time of their death. There were 140 or so over the past year. That's down. They used the same methodology last year, last calendar year, and it was 170 then. And I asked Reed about that, and she said that they think, they don't know. They think a lot of it might be because overdose deaths are down across the board, all over all populations. Overdose deaths are down, and that probably has played a role in it. There's the Narcan is available anywhere. It's just about everywhere you can get that, which is the drug that reverses opioid overdose symptoms. And then the Metro Drug Coalition is distributing fentanyl testing strips, where if you do have drugs, if you are an addict, you do have drugs, you can test them to see if fentanyl's in there. And fentanyl is, as most people know, is extremely deadly, and has been blamed for a surge in overdose deaths because it is so dangerous.
Right. We've kind of gone from the drivers of overdose deaths being prescription opioids like OxyContin to then heroin. And now in more recent years, these synthetic opioids like fentanyl have really taken over and have pushed those numbers higher. Yeah,
and they'll take heroin and cut it with fentanyl. we used to say cut. I guess you'd say they'd enhance it with fentanyl, but but there's that. But still, 140 or so people who live in Knox County died last year under less than ideal. I don't know if there's an ideal situation for death, but that is certainly not. It's certainly not living in a tent or under a bridge or wherever you happen to be in your unhoused situation. And community people went to the service, in part to remember them, and in part to also talk about things that can be done to prevent those deaths in the future.
Right. Well, and I think that one thing that is always worth keeping kind of clear in everybody's minds when we talk about homeless services is that our local governments, for the most part, do not provide direct homeless services. They do provide funding, the city in particular. The county provides funding too, although most of the county funding is essentially passed through federal money, HUD money. Mm. The city also has that passed through HUD money, but then dedicates local funds as well every year and spends a fair amount, but almost all of that money goes to these third-party nonprofit providers. Volunteer Ministry Center is the biggest in terms of receiving those because CARM, which is actually the largest homeless service, does not accept government funding because of what it could mean for they place various kinds of religious conditions on their services, and that becomes complicated if you're taking government money, so they don't. But all that to say that a lot of times, people kind of look at this and say, like, why doesn't somebody do something? And the first answer to that is people are. I mean, there are literally all these services we're talking about are operating every day. But secondly, this is mostly, there are cities, especially larger cities, where you have publicly operated facilities, shelters, maybe healthcare systems for homeless people. But here, traditionally, that has not been the case. Our local governments do provide support, but they're mostly not providing the services. And when it comes to these things like warming centers, those are almost entirely dependent on volunteer labor. I mean, there's some money that goes into them, but mostly they're counting on people at these churches and other facilities showing up and helping.
Yeah, and it came up last year, and it's come up from a couple of people this year. Well, why don't they use community centers or senior centers or whatever these public buildings for this? And one of the reasons is, first of all, that there are some state laws that you might not want to. You would have to enforce that. By very nature, these are low barrier shelters, and there's a little conflict there. There's also, but the big logistical problem is you don't know when these are going to be open until just a few days before.
So you get the weather forecast.
We got the weather forecast, a reliable weather forecast, not the 10-day forecast, more like the 3-day or 2-day forecast. And you don't know that the temperatures are going to be low, so you don't know when they're going to be needed. And all of these buildings have, programming. I mean, there are things that are going on, and there's that. And then there's also the staffing. You do have to have people staffing it overnight who would have to be volunteers, because, people who staff senior centers and staff community centers aren't, they've already got their day job. I mean, they could if they want to volunteer later. Yeah, great, but you can't make them. So there's some issues there, and that these churches fill fairly easily because they have, usually it's their educational wings of their buildings or whatever, but they have space that is unused most of the week, other than Sunday,
especially overnight.
And overnight, yes, and but they're also unused during the day because you've got to set up, you got to clean up, there's, just because people are only spending the night in these centers doesn't mean there's no activity at all during the day, because like I said, you have to clean up. There are supplies that have been donated. You have to get those out. One of the issues that Reed told me they had was they've run into is laundry. They need to work with partners to get laundry done when this is going on. But again, you don't know when that's going to be needed until a couple of days ahead of time. So, it's so that's kind of why the churches have the space. They also have essentially a built-in pool of volunteers, because people who attend these churches are, believe in helping other people, and will volunteer. And plus, other churches, not just the churches who are operating as centers, but other churches in the community provide volunteers for that.
They
so
put out the calls.
even though Vestal United Methodist is the South Knoxville church where the center is located, other churches in South Knoxville have been sending volunteers over there too. So it's it's a it is a that part of it especially is really volunteer driven, both at the macro level of the churches offering the space to the micro level of people who are volunteering to do the actual work. And but it's the same way with the other centers you mentioned. Volunteer Ministry Center gets a lot of work. The McNabb Center has when you talk about we need more mental health professionals and counselors and outreach workers. They're the ones who provide those, because you don't just take anybody and send them out and try to help somebody. They need training. They need to understand what their role is and what they're being asked to do, and what the rules are, what the laws are about the help they can provide. So the McNabb Center is a huge service delivery partner with the city and the other agents like the Volunteer Ministry Center and all that. It's a real kind of moving. There are a lot of moving parts there, and the Office of Housing Stability is supposed to coordinate those.
Right, and of course, we'll see how that all comes together in the master plan that they will present next year. All right, let's talk really quickly about a couple of interesting new developments, literal developments, real estate developments that came through our various bodies this past week. Starting with, Scott, an affordable housing development out in West Knox County that has some echoes of a prior controversial proposal out there.
Yeah, there is a proposal to build a 84-unit affordable housing complex in Hardin Valley. It's kind of between what you think of as Hardin Valley, the Hardin Valley exit, and Carnes on Hardin Valley Road out there. And the Dominion Group is proposing to do this. Dominion Group they do both market rate apartments. They're building one right over on the riverfront down at the north end of the South Knoxville Bridge and James White Parkway. They also do affordable housing, and this is going to be an 84-unit development. County Commission was asked to use some of their federal funds to support the construction of 4 of the units. These 4 units, all of the units will be affordable. These are supposed to be affordable, but it doesn't. These are called floating units. It's not necessarily unit 1A, 1B, 1C, 1D. Those are D4 units. It's 4 units throughout, and they can change as people move in and out. But there always have to be 4 that this funding goes toward. And they these will be affordable for 20 years.
And when we say affordable in this context, what are we talking about?
We're talking about up to 60% of the average median income for the area, which is about $74,000 a year now. HUD's gone up on that threshold because of primarily because housing costs have risen so much in the area. Anyway, there's a proposal there, and then Commissioner Angela Russell, though, who represents Southwest Knox County, spoke up and kind of led the opposition to this project. She cut her teeth and got her political start by being one of the leaders in charge against another Dominion group affordable housing project proposal in Choteau in Southwest Knox County, where she lives. And she mentioned that, said, I'm against these kinds of things, basically in wealthier neighborhoods.
I was elected to keep affordable housing out of West Knox County, and I'm going to do it.
Yeah, and her argument is that this is expensive land, that they could get land more cheaply elsewhere, which would drive down their development costs. One of the things that another thing that she brought up was that they're getting all these subsidies to build this project now, and then 20 years from now, when the affordability period ends, they can revert to market rate housing, and they've got this market rate apartment complex in an upscale part of town. So it's really going to help the developer. Of course, 20 years from now, they would have to really undergo some renovations to be market rate in
right.
West Knox County.
And also that's somewhat ignoring that the developers, if they chose to, could just go ahead and build market rate apartments right now. There's nothing stopping them from doing that.
Yeah, and and there were other commissioners were more sympathetic to Gina Oster, who represents the area, Terry Hill, Kim Frazier. They were all in one. I believe it was Terry Hill asked Jennifer Holden, who is the Senior Director of Grants and Community Development for the county, to talk about the communities. And one of the things that she mentions, Dominion Group has another affordable housing project closer in West Knox County, in West Knoxville, and was saying that one of the things that they found, it's been open about a year, and one of the things that they found is that these people who are, by definition, low income households who've moved into these apartments, actually are finding better jobs and making more money than they were when they moved in. And they think it's because of the proximity to better paying jobs in higher socioeconomic neighborhoods. And talking about one family that improved their income from $5,000 a year to, which was probably all public funding, to $50,000 a year in a year. And then another family increased their income so much they had to move out to market rate housing. So really talked about how the location of these sites in more affluent communities is actually good for the people who are residents there, and they're not detrimental to the neighbors. And one of the big concerns is property values, but basically unless you have a huge number of affordable housing developments in an area, in an affluent area, it doesn't affect it at all. So the studies
the kind of dispersed housing model is something that HUD at the federal level has really been pushing as policy in recent years. I think we're going to see a reversal in that under the Trump administration. They have already said that they do not support that model, but the idea of it, because basically they present it as, you're putting bad people in the middle of good people, by which they seem to mean poor people in the middle of more affluent people.
Yes.
But the theory behind it is exactly what you're saying, that having affordable housing scattered throughout a community it puts people closer to different kinds of jobs. It gives them access to amenities and resource schools, for example, that they might not be able to get to otherwise. And if you don't do that, what you get is what we had for much of the 20th century, which was just this ongoing concentration of poverty, where sort of all of your affordable housing is mostly in low-income areas, and it just becomes this kind of self-perpetuating thing.
Yeah, there are all kinds of reasons that mixed income neighborhoods and areas are beneficial, and one of them is in education. There have been studies that show that students from low income families perform better in schools where there are mostly affluent students than they do in schools that are mostly economically challenged students or families. So it's a lot of and if you make more neighborhoods that way, you have fewer fewer neighborhoods where the poverty is highly concentrated, where you do have schools that need more attention, schools that need more funding. There are all kinds of reasons that advocates push for this kind of dispersal of housing and creating more mixed income neighborhoods instead of having poor neighborhoods, middle class neighborhoods, and upscale neighborhoods.
And so Russell voted against it, and she was joined by the other two members of what we call the Eric Wyatter wing of County Commission, which is Commissioners Rhonda Lee and Andy Fox. All three of them worked with Wyatter, who's a local conservative campaign consultant, in running their campaigns, and remain close to him in terms of the policies they pursue. And Wyatter, and if you are on Facebook or other social media, you can look at Wyatter's own accounts on there and kind of see the priority he's putting on this. But Wyatter is pushing very hard against any kind of concentration of housing, any kind of density of housing in more suburban areas. He views it as social engineering. Andy Fox has said repeatedly that he's concerned that more density of housing leads to people having more liberal political views, which there is some statistical correlation on that, and so that's his given reason. So I think we have that three-person faction on commission that is going to continue to be, I think, very skeptical of affordable housing in more affluent areas, and of really any kind of density beyond 1 or 2 units an acre, pretty much anywhere in the suburban and rural parts of the county.
Yeah, and in fact, one of the next development we're going to be talking about,
let's do it,
is one that Fox has been opposed to in the past. It's a major builder, D.R. Horton, is wanting to build a large subdivision on Tipton Station Road in South Knox County. It's a 155-acre site. They want to put 342 units or lots on this site. They were able to get the zoning done and everything else that
local residents fought it at every step. They fought the rezoning at Planning Commission. They fought it at County Commission. Fox, once he got elected to County Commission this past fall, actually tried to reverse the rezoning because it's in his district in South Knox County to no avail. But so this past week it came for what will be its final approval as far as the actual project itself, which was the development plan coming back to Planning Commission, right? Yeah.
It's actually a little bit longer than a week ago. We're in real time lag on talking about this.
Yeah, that's true.
It came. Their development plans came back. Their concept plan and development plans have to be approved by county, the planning commission came back before them. One of the issues that's kind of popped up is that this company or this property used to be owned by Atlas Powder Company. Atlas Powder made black powder, made TNT essentially, and this property was used at least for the storage of TNT. One of the issues that came up was that they had to do an environmental assessment of the property that TDEC required. There's apparently a data gap in that, and whatever a data gap means, there's a data gap in the environmental, the phase 1 environmental assessment. So they have to do a phase 2 environmental assessment. That's not been done yet. That would determine whether remediation has to be done. One of the reasons they're doing that is because of this data gap. They are unsure if TNT was actually manufactured at this property, which is a different animal than if it was just stored there. If it's just stored there, it's really not that big of a deal, but the manufacturing of it would be cause for environmental concern. So that has yet to be done, and that was one of the reasons that neighbors who were there, did come and speak out, wanting that to be done before they approve the plan and all this, and which you can kind of understand. Well, yeah, okay, yeah, you want this. This is still out there, but one of the planning commission and the developer all agreed that they will have to have this completed, and if it calls for remediation, they'll have to have that remediation done before they can actually get permits and start building anything on there. So, their argument was that this is kind of baked into the process, is getting getting that done, because if it does come through and they do have to do the remediation, legally they will have to do that before they get any kind of permits for excavating, grading, building, anything. So planning commissioners did approve that, and it went on, and that is the for the site itself. That's the kind of last thing. I mean, once they do get that, they don't have to come back and get any kind of approval from planning commission when the environmental study comes back. They just have to have it when they go and try to get stuff done. And then that's, like I say, that's the last there is to do with the site itself. There's still some road improvements that they're caused by this development that are going to be taken up by county commission next week or next month. It may or may not end up getting placed under. Probably will be one of the first, if not the first, residential subdivision to be get infrastructure improvements paid for through the proposed residential infrastructure policy that is the county commission is going to be considering. We talked about that last week. Which whether they get that, however it ends up getting paid for, it's going to be improvements, a turn lane at one intersection, a roundabout at another intersection to try to help with traffic flow on Tipton Station Road, right through that area. So,
right, which is a special concern of the local residents.
Yes.
Tipton Station Road is not a large road.
No, it's not, and there has been a lot of development in that area in the last few years. Hardly a month goes by that there is not a proposal for a subdivision or a small townhouse development or something like that in that area,
especially along John Sevier Highway. That's where and this is kind of just south of John
Sevier Highway. Well, it's John Sevier Highway and south. Right. I mean, that whole area down through there has seen a lot of growth lately.
And that's the area that Commissioner Andy Fox, who again represents the district, has specifically said he really wants to protect everything south of John Sevier Highway from any kind of intensity or density, which is why he opposed this plan in the first place.
Well, and that's kind of hard to do in this area because, I mean, that's where South Doyle High School is.
Yep.
And so that's, schools are traditionally a kind of a magnet, a center of a community. And while that school serves a huge part of South Knox, all of South Knox County, it's including the portion that's inside the city limits of Knoxville that you wouldn't dream of considering to be rural. But in this area, it is it's kind of the social center of that portion of South Knox County, and it's kind of a natural thing. It happens everywhere. Gibbs is another good example of that. Well, is there really a community called Gibbs? Well, now there is because there's a Gibbs school out there. Was Harbison's Crossroads. So it's that is an area that people who are concerned about development trends and development activity should pay close attention to because there's a lot of it there.
Absolutely. All right, let's talk a little bit about Lillian Bean. Her full name was Sarah Lillian Bean, but everybody in Knox County who I ever heard talk about her has always just called her Lillian. And Scott, she passed away a couple of weeks ago, and word of that kind of came out this past week, and there were funeral and memorial services for her. And if you have moved to Knox County, or if you have only started paying attention to Knox County politics in, say, the last 10 or 15 years, that name might not ring a lot of bells. But if you've been around longer, it sure does. Because Lillian Bean was for 18 years the circuit court clerk here in Knox County, and she and her husband Richard, who was and still is the superintendent of our local juvenile detention center, which is named after him. That's how long he's been there. He's been there so long they named the building for him, but he's still there and he's still running it. They were a real force in Knox County politics for, around 20 years. They were one of the major factions in the local Republican Party. They had an operation that people called the Bean Machine, like in the sense of a political machine. And they always kind of downplayed that. You can find online a really good story from Metropulse, R.I.P. Metropulse, by local writer Betty Bean, no relation to the Bean Machine, about Lillian Bean's run for re-election in 1998, which is actually when she lost after 18 years in office. But that article focuses a lot on this question of what is the Bean Machine and does the Bean Machine really exist? And Lillian Bean, of course, always said that, people call it the Bean Machine, but it's just me and my husband and our friends and my 95 employees who all love me so much that they devote tremendous amount of time to political activities. And that was really what they were known for, was the Beans could, if they endorsed a candidate, they could turn out volunteers for fundraisers. They could get, door knockers for people. They provided, there were a lot of people sort of at the height of the Bean Machine power. There were a lot of local officials who were indebted to them because they helped them get elected. And they were especially sort of an old school patronage operation. Lots of county jobs over the years went to people connected to the Bean Machine. And like all political machines, they kind of they had their peak, and then there was kind of a decline as other factions arose in the County Republican Party. It's interesting because we talk about current factions within the County Republican Party. We were just talking about Eric Wyatter. He kind of heads up one faction. Current party chair Buddy Burkhardt is kind of like the more old school Republican establishment faction here, and there are some others as well. Well, there have always been factions in the Knox County Republican Party. There's always factions in political parties, but especially here, the Republican Party at the county level has been dominant for so long that the factions matter because a lot of people's jobs rely on them. This was traditionally, and to some degree still,